Friends, so yeah, we will begin with the MCQs here, and the question here is the first question which I am discussing here. It's a 4-year-old boy who presents with mental retardation, dystosis multiplex, coarse facial features, and clear cornea. What is the most likely diagnosis in this case? Options are Hurler syndrome, Hunter's disease, it's Mortev's Lambert disease, or it's a slight disease. So yeah, I'll just repeat the question. The question here, it's a pediatric question, and the question here, it's a 4-year-old boy who presents with mental retardation, dystosis multiplex. And you know what is dystosis multiplex? Dystosis multiplex basically it's a what to say again? It's a autosomal recessive. It's a mucopolysaccharide metabolism disorder in this case. So yeah, whereas it's a 4-year-old boy who comes to you with a mental retardation, dystosis multiplex, coarse facial features, and a clear cornea. So what is the most likely diagnosis here? And the options are Hurler's disease, Hunter's disease, or it's a Mortev's Lambert disease, or it's a slight disease. So if anyone wants to answer, it's a very peculiar question. So yeah, so the answer is usually Hunter's disease. B is the right answer, but you have to differentiate between Hurler's and Hunter's. So clinically, how will you differentiate between Hurler's and Hunter's? Is like in Hunters they have just given clear cornea. So clear cornea is basically a peculiar feature of Hunter's disease, whereas in Hurler's disease it is like it's a clouding is there. But yeah, you can just find it by the genetics. It's like if you have X-linked recessive, it's like a Hunter's, and if you have autosomal recessive, it's a Hurler's disease. So yeah, it's like this have to differentiate in this case. So yeah, I'll just repeat. It's a mental retardation, dystosis multiplex, coarse facial features, and clear cornea, which indicates it's a Hunter's disease. Let's move on. Now we have the question is G2P1 obese woman with diagnosed with arrest of the descent during the labor. Identify the following maneuver performed for this patient. You see, they have just given here this image they have given. Okay, I'll just tell me what is the most common maneuver you do for a shoulder dysplasia. Then you can just answer this. And the options are it's a Rubin's maneuver, McRoberts maneuver, and Giovanelli maneuver. It's a Wood-Corkscrew maneuver. So if you can tell, it is a common maneuver we use for a shoulder dystocia. It's the image they have given here, but yeah. Okay, if you want to answer this, you can answer, but I'll only answer this. So yeah, generally what we do for maneuver for a shoulder dystocia is it is McRoberts maneuver, and you know what we do. Basically, we do flexion and abduction of the maternal hips, and that too we put the thighs over the abdomen. Basically, what we do, the sacrum and the lumbar vertebrae, we make it in a straight line. So yeah, so it's the McRoberts maneuver. No, it's not a Rubin's maneuver. It's a McRoberts maneuver in this case. Yeah. So basically it's like it involves the flexion and abduction of the maternal hips, what I said, and that to positioning the maternal thighs on our abdomen. So yeah, and the most common nerve which is injured in the McRoberts maneuver, it's a B is the right answer. And the most common maneuver, that is what I was telling, the most common nerve which is injured in this maneuver is, if you want to tell, it basically is the lateral cutaneous nerve of thigh. So you have to remember this, the most common nerve injury during the McRoberts maneuver is lateral cutaneous nerve of the thigh. So next we move on. It's a newly married woman was found dead in her house. So on inquiry it was found by the neighbors that the couple used to fight a lot regarding dowry. So this is defined under which section of IPC? So I repeat, it's a newly married woman who was found dead in her house. So on inquiry it was found that it was informed by the neighbors that the couple used to fight a lot because of dowry. So this is defined under which IPC? It's like 304, that is 304A IPC, 304B, 174 CRPC, or it's 176 CRPC. So yeah, if you know IPC for dowry, you can just tell 304A, 304B, 174, or it's 176 CRPC. So okay, if you want to tell, it's okay. Basically we are talking here about dowry death. So in case of a dowry death, it's 304B IPC, not A. So it's a 304B IPC which we consider for dowry death. So yeah, 304A IPC is basically it's due to the death by negligence, and 174 CRPC, it's a police inquest, and that is 176 CRPC is magistrate inquest. So yeah, in this case it is case of dowry and debt zero dowry, that is it is 304B IPC we use. So next we move on. It's an elderly male patient who presents to the hospital with complaints of abdominal pain, increased frequency of micturition, passing of air bubbles in the urine. So he was been diagnosed with diverticulitis 2 years back and was treated with antibiotics. So what is the most likely diagnosis? So basically you have to tell a diagnosis in this case. I will just repeat the question once. It's an elderly male patient comes to the hospital with complaints of abdominal pain, increased frequency of micturition and passing air bubbles in the urine. So he was diagnosed as diverticulitis. Basically it's a fistula, I think. Yeah, he was diagnosed as a diverticulitis 2 years before and was treated with antibiotics. So what is the most diagnosis? Options are coloenteric fistula, colocutaneous fistula, colovesical fistula, or it's a emphysematous cystitis. So yeah, if you can tell it's which fistula it is. It's a coloenteric, colocutaneous, colovesical, or it's a emphysematous cystitis which we are talking about. So yeah, if you can tell. Okay, I will just tell. See, basically there was diverticulitis 2 years back as per the question they are given, and after 2 years what you find? Abdominal pain, increased frequency of micturition, and that too air bubbles in the urine. So if there is air bubbles in the urine, you have to think that was some fistula in this case. So yeah, so if you have in the urine, that is a bladder. So it was diverticulitis with a bladder fistula. So yeah, the right answer is C. That is a colovesicular fistula is the right answer because of air bubbles in the urine. You can tell. So yeah, air bubbles in the urine is called pneumomaturia. Okay, next we move on. Next we have it's a cryoprecipitate is useful for the management of patient with all of the following conditions except hemophilia A, von Willebrand disease, it's an hyperfibrinogenemia, or it's a Christmas disease. I repeat, cryoprecipitate is useful for management of with all of the following except it's a hemophilia A, von Willebrand disease, hyperfibrinogenemia, or it's a Christmas disease. So if you randomly also guess, it's okay. So yeah, anyone wants to answer this? Okay, see, it's a cryoprecipitate. The answer here is basically it's a Christmas disease. So why? Because in Christmas disease it does not contain factor number 9, and in cryoprecipitate it is like the contents of cryoprecipitate. I will just tell you the components now. The components of cryoprecipitate are it's like factor 8, 13, fibronectin, 1 Willebrand factor. So yeah, so cryoprecipitate is useful for the management of the following except. So the answer is Christmas factor because Christmas factor is basically it's the deficiency of factor number 9. So in cryoprecipitate we won't be getting all that. So yeah, so therefore it can be used in patient with hemophilia A, factor 13 deficiency, hyperfibrinogenemia, or it's in von Willebrand disease. So yeah, so I'll just repeat the components of cryoprecipitate. It's a factor 13, that is factor 8, fibronectin, and it's a von Willebrand factor. So yeah, move on to the next question. Yeah, it's a ABG question. It's important only. So it's a ABG of an unconscious man which shows pH is 6.9, HCO3 is 13, PaCO2 is 68 mmHg, and you have to tell the acid-base status here. So the acid-base status of this patient is best described by options are uncompensated metabolic acidosis, uncompensated respiratory acidosis, or it's a simultaneous respiratory and metabolic acidosis, or it's a respiratory acidosis with partial renal compensation. So I'll just repeat the values here. You can just code it with that. The values are pH is 6.9, HCO3 is 13, PaCO2 is 68. So now just you can tell which of the values you have. So yeah, see, pH is 6.9. Normal pH, it's between 7.4 to something like that. It is like that. So it's a low pH. So it's a case of acidosis. Then we have HCO3 is 13. So yeah, HCO3 is also basically 13. It is also low. So it's a case of metabolic acidosis in this case. And we have PaCO2 that is 68 mmHg they have given. So yeah, it indicates there is a coexisting respiratory acidosis as the direction of PCO2 change is the same as that of pH change, suggesting that it's a mixed acid-base disorder. So yeah, and PCO2, there is a formula, as you know, it's 1.5 into HCO3 plus 8 plus minus 2. Because it's a 26 to 30 is the answer here. So yeah, it's a case of a simultaneous respiratory and metabolic acidosis. Why? pH is low because 6.9 is a low pH, HCO3 is also low, and PaCO2 is 68, that is also low in this case. So yeah, so it's an simultaneous respiratory and metabolic acidosis in this case. So to remember normal values of all the things, like normal value of pH is 7.35 to 7.45, HCO3 is 20 to 28, PCO2 is 35 to 45. So yeah, next we move on. It's an easy one, I think. Yeah, what is the most common cause of injury related death? So I repeat, what is the most common cause of injury related death? And the options are interpersonal violence, falls, RTA or suicide. It's a very easy question. I will just repeat for last time. What is the most common cause of injury related death? It's interpersonal violence, falls, RTA or it's a suicide. So it's an easy question. In casualty we have seen the most of the cases of death, that is due to which condition. So yeah, the answer is C, that is RTA. We see the most common. It's an injury related death, and yeah, it's an RTA. So next we move on. It's a 15-year-old boy who presents to you with the complaints of fever and malaise. So he also complains of an itchy rash which first appeared on the trunk as shown below. So when is this disease the most contagious? So basically you have to just tell the diagnosis first in this condition. I will just repeat the question for you. It's a 15-year-old boy who comes to you with the complaints of fever and malaise. So he complains of an itchy rash which first appeared on the trunk as shown below. So when is this disease most contagious? So the image is basically, it's a, I will just tell you the image. Yeah, it's a case of chickenpox. Now you can tell, I think. Yeah. So just tell me when is this disease, that is chickenpox, the most contagious? The options are after formation of scab, or it's like 2 days before and 5 days after the onset of rash, or it's like 7 days before, 7 days after the onset of rash, or it's 4 days before, 4 days after the onset of rash. So yeah, if you can tell, just tell chickenpox. It's a case of a chickenpox, and yeah, we know it's a varicella only. So yeah, so when is the disease most contagious? I just repeat, it's after the formation of scab, 2 days before, 5 days after onset, then 7 days before, 7 days after, and last option is 4 days before and 4 days after the onset of rash. So yeah, if you can tell. Anyone wants to answer this? The communicability for chickenpox. So yeah. Okay, the answer here is B. Okay, the B is the right answer. B basically, it is most contagious. Chickenpox is contagious when it is like 2 days before and it's like 5 days after the onset of rash. So yeah, you have to remember this is 2 days before and 5 days after the onset of rash. That is, chickenpox is the most contagious. So next we move on to the next question. It's which of the following adverse effects is least likely in a patient who is on chronic amiodarone therapy? So it's also a very interesting one. Yeah, that was the right answer. So yeah, it's a very interesting question. Which of the following adverse effects is least likely in a patient who is on a chronic amiodarone? So you know amiodarone, when we give amiodarone, basically we give amiodarone in case of arrhythmias. So yeah, the question is which of the following adverse effects is least likely to be in a patient who has a chronic amiodarone therapy? Options are dry cough, corneal microdeposits, hepatic dysfunction, or it's a nephrotoxicity. So yeah, if you know the adverse effects of amiodarone, you can just tell. So yeah, I know the answer here. So yeah, if you know the answer, you can just tell which is the adverse effects of amiodarone that is used for arrhythmias. So yeah, which is the least likely to be in a patient with chronic amiodarone. So yeah. Okay, the answer is, I will just tell, it's the answer is D. See, nephrotoxicity is not an adverse effect of amiodarone, you have to remember that. Dry cough, hepatic dysfunction, corneal microdeposits are there. That is, pulmonary fibrosis is also there. But yeah, It's a chronic condition of amiodarone therapy. So yeah, nephrotoxicity is not an answer for this. So I will just tell what are the side effects of amiodarone. The side effects of amiodarone, as I've already told, it's a dry cough that is due to pulmonary fibrosis. We have corneal microdeposits, hepatotoxicity, but not nephrotoxicity. You have to remember that it's not nephrotoxicity in this case. So you have photosensitivity, thyroid dysfunction, all that is there. So next we move on. We have which of the following is a type of cortical dementia. Yeah, it's a easy one if you know. Which of the following is a type of cortical dementia? Options are Parkinson's disease. Then we have Huntington's disease, Alzheimer's, or it's a Wilson's disease. So yeah, it's a easy one if you know. You can just tell which of the following is a type of cortical dementia. Options are Parkinson's, Huntington's, Alzheimer's, or Wilson's. So yeah, if you can just guess off if you don't know also. So yeah, anyone wants to tell which of the following is a type of cortical dementia? Dementia usually it's a degenerative. So anyone, Parkinson is also degenerative, Alzheimer's is also degenerative, but yeah. Okay, the answer is C. Because C, cortical dementia we see in patients with Alzheimer's disease. And yeah, as you know, dementia is defined as a disease, progressive cognitive impairment and clear consciousness. Because you know you are conscious, but you have dementia, that is, you don't know about you can just tell the past. So yeah, depending on the site of the cerebral lesions, the dementia are classified as two, that is subcortical and cortical. So yeah, Alzheimer's is a type of cortical dementia. So you have to remember that. So next we move on. 24-year-old woman comes to the gynecology OPD for a routine pap smear. So histopathological slide they have given below. I'll just tell what it is, and you have to identify the cell marked as A. So I think I cannot just tell the answer. I will just tell the answer here. It's they have marked as superficial cell. So yeah, it's a superficial cell. Okay, I'll just repeat. It's a 24-year-old woman who comes to gynecology OPD for a routine pap smear. So basically, you have taken a pap smear in this case, and you are basically on the histopathological slide. You are telling me to show what is A, and A is the superficial cell. So I'll just so yeah, in the histopathological image of a pap smear, what we see, it's an squamous cell. We will see there will be basal cell, superficial cell. Usually according to the carcinoma, we have to tell. So yeah, coelocytes are the epithelial cells that contain eccentric hyperchromatic moderately enlarged nucleus, and it is displaced by a large perinuclear vacuole. It is a feature of HPV infection. So yeah, next moving on. It's a case of a congenital adrenal hyperplasia on steroid therapy, and he comes to you with vomiting and fever. So now you administer double the regular dose of steroids in this case. So which drug is being referred to here? I'll just repeat the question. A patient who has a congenital adrenal hyperplasia comes to you with, who is on steroid therapy, he comes to you with vomiting and fever. So now you administer double dose of regular steroid. So which drug is being referred to here? Options are dexamethasone, betamethasone, prednisolone, or it's a hydrocortisone. So basically you have to just tell what adverse effects is causing the patient with this, which steroid is causing the patient to have vomiting and fever in this case. So yeah, if you know the adverse effects of steroids, you can just tell this answer. So yeah, okay, it's a case of congenital adrenal hyperplasia, and generally what you give a hydrocortisone. Yeah, so drug of choice for that is a congenital adrenal hyperplasia is hydrocortisone. So when you give hydrocortisone, you have to think of the side effects also. And yeah, the side effects is like vomiting and fever is a side effect of hydrocortisone. So yeah, and double or triple doses are indicated during periods of stress such as infection or surgery. So yeah, it's hydrocortisone is the right answer. Next we have in a patient with a suspected systemic amyloidosis, which of the following is the initial investigation of choice? So I'm not telling what is the investigation of choice, I am just asking what is the initial investigation of choice in a patient with suspected systemic amyloidosis. Options are kidney biopsy, abdominal fat staining, bone marrow aspiration, or rectal biopsy. So yeah, if you want to answer this, just guess also. I will just repeat, it's a kidney biopsy, abdominal fat staining, bone marrow aspiration, or it's a rectal biopsy. So yeah, if you want to just initial investigation of choice. Okay, I'll just tell the answer. It's basically B is right answer. That is the abdominal fat staining you do that is the initial investigation of choice for systemic amyloidosis. So yeah, so diagnosis involves if it's a local or systemic, we have to basically do in that way. And amyloidosis, it's basically fat deposits. So fat deposits in the body. Yeah, deposit can be found in any tissue of the body. So initially we do a non-invasive test, which I told, that is the abdominal fat staining, and if it is negative we will do a more invasive test like biopsies of the kidney, heart, lung or GI tract. And in suspected we have its serum and urine electrophoresis we can do. So yeah, moving on to the next question. It's ECG. Yeah, next we have, it's a 68-year-old man who comes to you with hypertension and was diagnosed with drug-resistant pulmonary tuberculosis. 1 week after starting ATT, he presented to the casualty following an episode of syncope. ECG, which has been shown here, its ECG shows it's a corrected QT interval of 477 milliseconds, which is shown below. So which drug is used in his anti-TB therapy responsible? Basically, they are just asking, he was a patient with TB and we have given an anti-TB drug. So which anti-TB drug will cause an adverse effect like this? That is, adverse effects are having like syncope is there, and ECG will show a corrected QT interval of 477 milliseconds. So to just tell which is the adverse effect for this. So your options are clofazimine, isoniazid, betaquilin, or it's a para-amino salicylic acid. So yeah, if you know the answer, you can just tell. So which adverse effect is basically for this condition? Okay, I'll just tell the answer is betaquilin. So yeah, betaquilin is the anti-TB drug which will cause this, which will cause like there will be a corrected QT interval. Sorry, there is a corrected, it's a QT interval of 477 milliseconds. So yeah, so QT prolongation is the adverse effects of betaquilin. So yeah, they have just given an explanation. I'll just read it off. The explanation they have given, it's an ECG QTC, that is the 477 milliseconds. So normal QTC interval in an ECG is 440. So it's a case of a QT prolongation. So yeah, if you have a QT prolongation, that too, if you are given an anti-TB drug, so you have to remember it's adverse effects of betaquilin. So betaquilin is the right answer. That is a adverse effect for this drug causing a QT prolongation. And you have to remember the normal QT also. Normal QT is 440, and if they are given 477 milliseconds. So next we move on. It's a case of a 35-year-old female, and it's a patient of Asian ethnicity with a BMI of 34. So she decides to seek surgical options to reduce her weight. That is, we have to do a bariatric surgery, I think. She has multiple comorbidities. Which of the following would make her unsuitable for a bariatric surgery? So yeah, it's a surgery question. If you know, it's an easy one also. I will just repeat. It's a 35-year-old female who is an Asian and BMI is 34 and has decided to seek surgical option for to reduce her weight. So she has a also deal-lamented QT prolongation. So now this 35-year-old who has a BMI of 34 kg per millimeter square wants to reduce her weight by a bariatric surgery. So she has a multiple comorbidities. So which of the following would make her unsuitable for a bariatric surgery? And the options are coronary artery disease, BMI below the cutoff for the surgery, severe depression, or it's a PQN syndrome. So if you can tell which of the following would make her unsuitable for a bariatric surgery. Bariatric surgery basically you have to reduce the fat, you have to remove the fat on the body. So the options are coronary artery disease, BMI below the cutoff for the surgery, it's a severe depression, or it's a PQN syndrome. So if you can tell which would make her unsuitable for a bariatric surgery. So anyone wants to answer this? Okay, the answer is, it's a very unexpected. It's not unexpected, but yeah, it's the answer. So the answer is C, that is severe depression. If a patient is having a severe depression, you cannot do a bariatric surgery. It would make a patient unsuitable for a bariatric surgery if you have a severe depression. So yeah, the patient should be psychologically stable before undergoing a bariatric surgery. So there are some international criteria for this. The BMI should be greater than 40 kg per meter square regardless of the obesity. It's actually indication for bariatric surgery, I think. Yeah. And yeah, the BMI should be greater than 35 kg with comorbidities and who has failed to lose weight despite everything like lifestyle modification, pharmacotherapy and all that. And is psychological stable, motivated and capable of understanding lifestyle changes. So yeah, if there is a patient with severe depression, it's not considered as a patient for a bariatric surgery. Next we move on. The most common sequelae of a traumatic dislocation of shoulder is in young adults is, I will just repeat, the most common sequelae of a traumatic dislocation of the shoulder in a young adult is subscapular tendinitis, rotator cuff muscles, rotator cuff injury, recurrent dislocation of shoulder, or it's a frozen shoulder. So yeah, if you can just tell which is the most common sequelae of traumatic dislocation of the shoulder in a young adult. Subscapular tendinitis, rotator cuff injury, recurrent dislocation of shoulder, or it's a frozen shoulder. It's a traumatic, not a... So yeah. So anyone wants to answer this? The most common sequelae? Okay, the answer is very simple. The answer here is recurrent dislocation of shoulder. So whenever you have a traumatic, that is, they have given the question was the most common sequelae of traumatic dislocation of the shoulder. So whenever you have a traumatic dislocation of the shoulder, it means that the glenoid labrum is injured. So whenever the glenoid labrum is injured, it's a possibility there will be recurrent. So yeah, the answer is C, that is a recurrent shoulder dislocation. So yeah. So what they have given that only there will be a tear of the glenoid labrum and it will result in loss of attachment of the inferior glenohumeral ligament, which is a primary stabilizer. So yeah, the answer is that only there will be a recurrent dislocation of shoulder because of the injury to the glenoid labrum. So next we move on. It's you have to calculate the ECI volume in a volunteer in whom 10 gram of mannitol was injected in a venous blood. So at equilibrium, urinary excretion of mannitol was found to be 10% and the plasma concentration was 65 mg per 100 ml. And the options are 14 liter, 10 liter, 28 and 20 liter. Basically, I also don't like these questions, but yeah, it comes in the exams. So yeah, it's calculate the ESF volume and 10 gram of mannitol was injected to the patient. So at equilibrium, urinary excretion was found to be 10% and the plasma concentration was 65 mg per 100 ml. So basically, what they are asking only, I don't know. Yeah, ESF volume, yeah. They are asking the ESF volume for this condition. It's 14 liter, 10 liter, 28 or 20. Yeah, if you can answer this. Anyone wants to answer this? It's basically you have to find out the ECF volume. And it's like ECF volume with 10 gram of mannitol injected to the venous blood. And at equilibrium, urinary excretion is 10% and plasma concentration is 65 mg per 100 ml. So yeah, there is a formula for this. It's like V is equal to amount injected by amount excreted by concentration. So yeah, so approximately it's coming 13.8 liter. So you have to remember the formula in this case. It's a mathematical question and the formula is ECF volume is equal to amount of injected, that is here they have given 10 gram minus amount excreted by concentration. So basically it comes around 10 gram and all that, it comes around 13.8 liter. So next we move on. It's the histological examination of the heart of a patient who died due to heart failure is given below. So what underlying condition did the patient most likely have? Options are hypertrophic. I'll just tell you, I cannot show you the image. I will just tell you what they have given the image. So yeah, it's a ninja star. I also heard. So yeah, in the image they have given below, it's a histological image. And the image shows the ninja star-like nuclei in myocytes. I repeat, it's a ninja star-like myocytes in the myocytes or given in the histological image. So I'll just repeat the question. It's a histological examination of the heart of a patient who died due to heart failure is given below and it shows ninja star-like nuclei in myocytes. So what underlying condition did the patient most likely have? So the options are hypertrophic cardiomyopathy, restrictive cardiomyopathy, or rhythmogenic cardiomyopathy, or dilated cardiomyopathy. So yeah, it's a typical. If you have a ninja star like in myocytes, you have to think of what. So I will only tell it's like D, that is then dilated cardiomyopathy is very specific for this condition. So in dilated cardiomyopathy, you will see a ninja scar like nuclei in the myocytes. So yeah. So yeah, you have to remember this. There is nothing ninja star like you know. Let's move on. Next question we have. It's a 20-year-old woman who comes to the complaints of Jamaeus, Wu and new onset seizures. So CT scan you do, it's normal. So laboratory values are given below. So which of the following is not a dermatological manifestation of this disorder? Options are, no, first I will tell the CBC. Hemoglobin they have given 8. Platelet is 1,16,000. ANA titer greater than 1:80 and anti-DS-DNA positive. So yeah, if you just think of it, if it's an anti-DS-DNA positive and that too ANA titer is greater than 1:80, what is the case? From this only you can just tell what is the case here. So I'll just repeat for the sake. It's a 20-year-old woman who comes with Jamaeus, Wu and new onset seizures. CT brain normal. Laboratory values you have hemoglobin 8, platelet 1,16,000, ANA titer that is greater than 1:80 and anti-DNS positive. So which of the following is not a dermatological manifestation for this disorder? So you know, see, from anti-DS-DNA only you can just tell it's a SLE. So no need to read the whole question again and again. It's an SLE case. So yeah, when you have a SLE, it's so they are asking which of the following is not a dermatological manifestation of SLE. So yeah, the options are discoid lesions, painless ulcer on hard palate, or it's a photosensitivity, or the salmon rash. So it's a easy one. You just have to tell which of the following is not seen in SLE. I will repeat for the last time. It's a discoid lesions, painless ulcer on hard palate, or it's a photosensitivity, or it's a salmon rash. So yeah, if you can tell, it's a case of SLE. So I think you won't answer this. Okay, I'll only answer this. It's a salmon rash. Salmon rash is not seen in SLE. Salmon rash is basically seen in Still's disease. That too in adult form of Still's disease, salmon rash is seen. And other options are like discoid rash, discoid lesions, painless ulcer on the hard palate, and photosensitivity is a feature of SLE. So there is no, it's a classic triad in SLE, that is, okay, there is it's more common in female malar rash, butterfly rash, you all know. Photosensitivity will be there, discoid rashes will be there. So yeah, there is a triad in Still's disease, that is a persisting high spiking fever, joint pain and salmon rash, which I was talking about. So I'll just repeat, it's a classic triad in Still's disease, that is a persistent high spiking fever, joint pain and salmon rash. Next we move on. Which of the following is the most common carpal bone injury? Options are lunate fracture, perilunate dislocations, scaphoid fracture, or it's a transcarpal fracture dislocation. So yeah, it's a easy one if you know. Most common carpal injury: lunate fracture, perilunate dislocation, scaphoid fracture, or it's a transcarpal fracture dislocation. So I also know this answer, but if you know the answer, okay, I will just tell it's a scaphoid fracture is the right answer. So you have to remember this. Scaphoid fracture is the most common carpal bone injury. So yeah, it's a scaphoid fracture which is the most common carpal bone injuries. So next we move on. A patient comes to you with patient undergoing a dental extraction develops breathing difficulty, swelling of lips and a diffuse rash following local anesthetic administration. So which of the following agents is commonly implicated? So yeah, it's an anesthesia question. The options are lidocaine, procaine, pilocaine, or it's a bupivacaine. I'll just repeat, it's a patient who is undergoing dental extraction, develops breathing difficulty, swelling of the lips and a diffuse rash following local anesthetic administration. So which of the following agent is most commonly implicated in this condition? It's a lidocaine, procaine, pilocaine, or it's a bupivacaine. So anyone wants to just guess? It's a dental procedure which we are doing. So which adverse effects will have this? Breathing difficulty, swelling of lips, diffuse rash. So yeah, if you want to tell you can, but no one wants to tell, I think. So yeah, the answer is it's a procaine. So yeah, okay. So yeah, the answer is procaine. Procaine has the adverse effects like breathing difficulty, swelling of lips, and that is a diffuse rash following the local anesthetic, that too in the case of dental procedure. So yeah, it's an allergic reaction to a local anesthetic. So yeah, it's due to procaine. So you have to remember it's a procaine which causes allergic reaction, causing breathing difficulty, swelling of the lips, and diffuse rash. So next we move on. It's next question we have. You are compiling a literature review on congenital cataract diagnosed in the last few years. So which of the following is the most common type? So basically you have to tell which of the following is the most common type of congenital cataracts. You have to tell. It's a blue dot cataract, lamellar, posterior pole, or it's a total congenital cataract. So just tell me which is the most common congenital cataract. Blue dot, lamellar, posterior pole, or it's a total congenital cataract. So if you can just remember and tell, otherwise I am there to tell. So yeah, the most common type of congenital cataract. Okay, I will only tell it's a blue dot. So yeah, the most common type of cataract is blue dot cataract. So you have to remember this, there is no choice. Okay, last 3 questions I think. Yeah, so you are an ENT surgeon and following are a few patients with otosclerosis. So for which of the following patient will you advise stepedotomy? So it's a multiple choice question. You have to tell which of the following patient you will advise stepedotomy. Factory worker with no other comorbidities, a 35-year-old male with Meniere's disease, a 28-year-old male with commercial pilot, who is a commercial pilot, a 30-year-old female with bronchial asthma, or it's a middle-aged man with diabetes and absent Schwartz sign. So yeah, it's a multiple choice question, but if you can answer this, you are an ENT surgeon and following are the few patients with otosclerosis. So which of the following patient will you advise stepedotomy? So I repeat, it's a factory worker with no comorbidities, is 35-year-old with Meniere's disease, or a 28-year-old who is a commercial pilot, 30-year-old female with bronchial asthma, or it's a middle-aged man with diabetes and absent Schwartz sign. So if you can tell the answer, it's good only. Yeah. Anyone wants to answer this? Which of the following will you advise? So okay, the answer is basically it's 4 and 5. That is 30-year-old female with bronchial asthma, and it's a middle-aged man with diabetes and absent Schwartz sign. You can advise stepedotomy because the others are the contraindication. Like only hearing, that is if you have a unilateral hearing, you cannot do stepedotomy. If you have a positive Schwartz sign, you cannot do stepedotomy. So yeah, it's like that many are disease pregnant women and pilots and who work in noisy surroundings. So they are contraindication for stepedotomy. So you have to remember that. So yeah, 4 and 5 only you can just advise stepedotomy, that it was a bronchial asthma and diabetes with absent Schwartz sign. If you have a positive Schwartz sign, you cannot advise a stepedotomy. It's a contraindication. So yeah. Next we move on. 1 MCI of any radioisotope equals to 37 megabecquerel, 21 megabecquerel, 54, or it's a 74. So yeah, it's a factual question. If you know the answer is okay, otherwise I am there to tell. So yeah, 1 MCI, it is not that MCI, but yeah, 1 MCI of any radioisotope equals 37, 21, 54, or it's a 74 megabecquerel. So yeah, if you can answer, that is a millicurie. So it's a factual question. I will only answer. I know most of you, I also don't know this answer. The answer is basically it's a 37. So yeah, 1 millicurie of any radioisotope equals to 37 megabecquerel. So yeah, it's not possible to remember, but yeah, if you can remember this, 1 millicurie equals to 37 megabecquerel. So yeah, it's the last question for today. 15-year-old boy who comes to the OPD with a high-grade fever, chills, rigors for the past 3 days. So a peripheral blood smear revealed the following, which I will tell you. So which of the following is false regarding the diagnostic method used to detect the condition he is likely suffering from? So I think it's a ring trophoblasts. Yeah, it's a ring trophoblasts only. But many times the same image they have given before also. So yeah, it's a ring form. I am right. It's a ring form which they have given in the image. So whenever you have a ring form in the image, you think of falciparum malaria only. So yeah, so basically the question is which of the following is false regarding the falciparum malaria. So the options are A, that is the Jaswant Singh Bhattacharya strain is used for peripheral smear examination. B, HRP2 antigen test is done for detection of Plasmodium vivax, or its acted in orange dye is used in quantitative Buffy code method, or the last option, rapid diagnostic test have a lesser sensitivity than microscopy. So yeah, so basically it's a clinical scenario of falciparum malaria. So which of the following is false? I'll just repeat for last time. Which of the following is false regarding the falciparum malaria? First, Jaswant Bhattacharya stain is used for peripheral smear examination. Second, HRP2 antigen test is done for detection of Plasmodium vivax. Or third, acted in orange dye is used for quantitative Buffy code method. Or it's D, that is the rapid diagnostic test have a lesser sensitivity than microscopy. So yeah, if you can tell. Okay, if you can tell the answer, if anyone wants to answer this. It's very easy. Why I will tell, they have given you the question for malaria, that is the falciparum malaria, and the second option which they have given is HRP2 antigen is done for Plasmodium vivax. So whenever they are given for its falciparum, you cannot expect Plasmodium vivax in this case. So yeah, the answer is very simple. It's HRP2 antigen test is done for detection of Plasmodium vivax is the wrong answer. So yeah, it's basically for Plasmodium falciparum. And yeah, Jaswant Singh Bhattacharya stain is routinely used in India to stain peripheral blood smear for diagnosis of malaria, and acrid in dye orange is also used as a quantitative Buffy code. And rapid diagnostic test is based on detection of antigen using the immunochromatography methods. So yeah, we are done with these questions and it's over for today. Thank you so much for joining, and yeah, good night, take care.